Hello everyone. Welcome to our channel. In this video, we will be discussing tips on how to manage anxiety. Compared to depression, anxiety disorder may still be an unfamiliar term to some of us. Anxiety disorder is a mental disorder in which the sufferer experiences excessive worry and anxiety. Anxiety is a condition that is often experienced by many people, and we all need to learn how to deal with it so that it doesn't interfere with our mental health and well-being. Learn more here about what anxiety disorder is, its causes, symptoms, types, and treatments. Let's get started. Introduction to anxiety. What is anxiety disorder? Anxiety is a psychological condition characterized by feelings of restlessness, fear, worry, and excessive anxiety. Anxiety can happen to anyone, and in fact, anxiety is a natural response of the body to situations or events that are perceived as dangerous or scary. Types of anxiety disorders. Next, let's identify the types of anxiety disorders. There are several types of anxiety disorders that are commonly experienced, such as generalized anxiety disorder, phobias, social anxiety disorder, post-traumatic stress disorder, panic disorder, and obsessive-compulsive disorder. Let's discuss each type of anxiety disorder in more detail. 1. Generalized anxiety disorder. Generalized anxiety disorder is a type of anxiety characterized by constant worrying, difficulty concentrating, and difficulty sleeping. Generalized anxiety disorder. Constant worrying. Generalized anxiety disorder. Difficulty concentrating. Generalized anxiety disorder. Difficulty sleeping. 2. Phobia. Phobia is a type of anxiety characterized by excessive fear of certain objects or situations, such as fear of heights, fear of snakes, fear of dark rooms, fear of seeing patterns with holes, fear of certain foods, fear of certain colors, and others. Phobia. Fear of heights. Phobia. Fear of snakes. Phobia. Fear of dark rooms. Phobia. Fear of seeing patterns with holes. Phobia. Fear of certain foods. Phobia. Fear of certain colors. 3. Social anxiety disorder. Generally, this feeling of worry is triggered by fear or embarrassment when in a crowd. They feel they will be judged by others, they are afraid of being misunderstood, they are afraid of speaking wrong, and so on. Social anxiety disorder. When in a crowd, they feel they will be judged by others. 4. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder or post-traumatic anxiety disorder often occurs in someone who has experienced a traumatic event, such as being the victim of robbery, suffering a severe injury, or being in a life-threatening situation, such as being in a war zone. People who have been in conflict areas. Post-traumatic stress disorder, PTSD. Such as being the victim of robbery. 5. Panic disorder. Panic disorder is a condition characterized by repeated episodes of sudden panic attacks that occur suddenly, without any clear cause, and can occur anywhere and at any time. This condition can occur repeatedly and can disrupt daily activities and relationships with others. Panic disorder. Sudden panic attacks that occur suddenly, without any clear cause. 6. Obsessive-compulsive disorder, OCD. Meanwhile, obsessive-compulsive disorder is an anxiety disorder characterized by constant obsessive thoughts and repetitive behaviors aimed at eliminating these obsessive thoughts. For example, repeatedly washing hands out of fear of not being clean from germs. Obsessive-compulsive disorder, OCD. Repeatedly washing hands out of fear of not being clean from germs. Symptoms of anxiety disorder. Symptoms of anxiety disorder. The symptoms of anxiety can vary widely, but some of the most common are: 1. Difficulty thinking and concentrating. Difficulty thinking and concentrating. 2. Prolonged headaches. Prolonged headaches. 3. Prolonged bloating. Prolonged bloating. 4. Difficulty sleeping for days or weeks, triggered by worrying without reason. Difficulty sleeping for days or weeks, triggered by worrying without reason. 5. Experiencing muscle tension, such as tightness in the jaw, hands, stomach, and others. Experiencing muscle tension, such as tightness in the jaw. Experiencing muscle tension, such as tightness in the hands. Experiencing muscle tension, such as tightness in the stomach. 6. Experiencing panic attacks without a clear cause. Experiencing panic attacks without a clear cause. 7. Feelings of restlessness, excessive worry, fear, and anxiety without cause are not normal most of the time. Feelings of restlessness, excessive worry, fear, and anxiety without cause are not normal most of the time. 8. Changes in behavior and difficulty carrying out activities or functions in life. Changes in behavior and difficulty carrying out activities or functions in life. These symptoms can be very disruptive and hinder daily activities because of the difficulty in controlling excessive anxiety. Causes of anxiety. Causes of anxiety. So far, no one has been able to explain the exact cause of anxiety disorder. However, in general, there are several factors that greatly influence the risk of anxiety disorders, such as the environment, stress, social situations, work pressure, family problems, and traumatic events in the past. Knowing the causes of anxiety can help us better understand the condition we are experiencing. Tips for dealing with anxiety. Tips for dealing with anxiety. Now, let's discuss tips and strategies for dealing with anxiety. First, get enough rest. Get enough rest. Second, adopt a healthy lifestyle such as quitting smoking, quitting caffeine, and quitting alcohol. Adopt a healthy lifestyle such as quitting smoking, quitting caffeine, and quitting alcohol. Third, meditation and yoga can help reduce anxiety by making us more relaxed and focused on our breathing. Meditation and yoga can help reduce anxiety by making us more relaxed and focused on our breathing. Fourth, exercise is also very important in reducing anxiety, as it helps release endorphins that can make us feel happier and more relaxed. Exercise is also very important in reducing anxiety, as it helps release endorphins that can make us feel happier and more relaxed. Fifth, seeking professional help and therapy can be effective in dealing with anxiety, and medication can also be prescribed by a doctor if necessary. Seeking professional help and therapy can be effective in dealing with anxiety, and medication can also be prescribed by a doctor if necessary. Closing. That's all for today's video. We hope these tips are helpful and informative for you. Don't forget to subscribe to our channel for more personal development content, and see you in the next video.